Hi everyone, my name is Nick Util, and this is a presentation regarding physician and practice level performance. For this presentation and analysis, we have compiled the following data. We have patient experience scores for 5 CG-CA-PHS measures. CG-CA-PHS is the Clinician and Group Consumer Assessment of Healthcare Providers and Systems. This data is from 2018 and 2019, and these measures include care coordination, courteous and helpful office staff, getting timely care, appointments, and information, how well your providers communicate, and patients' rating of provider. Additional data included in our analysis dataset include 2 different practice levels, internal and family medicine. We also will be splitting data up by physician levels. We have MD, medical doctor, and DO, doctor of osteopathy. We do also have data for advanced registered nurses. However, we did not include these in the analysis as they were not considered physicians. Here at the top, we have an average patient experience survey score for physicians. We see that both the DO and MD have the same average patient experience score. Additionally, in the lower visual, family medicine has a slightly higher average patient experience score for the 5 measures that we did specify earlier. However, you will notice that the difference between family medicine and internal medicine is minimal. Here we have percent of total surveys returned by physician at the top. As you can see, the MD accounted for almost 60% of returned surveys. Additionally, at the bottom, you will note that the internal medicine accounted for almost 60% of returned surveys for these 5 measures as well. Here we begin our comparisons of the average patient experience survey score for 5 of the Clinician and Group Consumer Assessment of Healthcare Provider and Systems measures. On the left, we have the comparison of patient experience survey score for care coordination. So you can see both physician levels scored above the national benchmark of 79.6%. On the right, we have patient experience score split by practice. Family and internal medicine are also above the national benchmark. Here we have a comparison of the patient experience survey score for courteous and helpful office staff. On the left, you can see that the medical doctor is slightly below the national benchmark of 84.4%, while the doctor of osteopathy is above. On the right, we see that family medicine is just above the national benchmark, while internal medicine is below. These next 2 graphics show the average score split up by month for courteous and helpful office staff for both the MD, who is below the benchmark, and internal medicine, which is below the benchmark. You can see here, throughout an almost 2-year span, where the average patient experience score for the MD is below the benchmark, but there are instances where the average patient experience score is above the benchmark. Similarly, for internal medicine, overall the average patient experience score was below the national benchmark. However, when we graph this by month between 2018 and 2019, we do see that there are actual multiple months where the average patient experience score for that month is above the national benchmark. Here we have the comparison of patient experience survey score for getting timely care, appointments, and information. As you can see, both physician levels are above the national benchmark of 69.8%. And here we have comparison of the patient experience survey score for getting timely care, appointments, and information split by practice level. And as you can see, both practice levels are well above the national benchmark of 69.8%. On the left, we have comparison of patient experience survey score for how well your providers communicate, split by physician level. Unfortunately, both physicians have average scores below the national benchmark of 90.4%. On the right, we have average patient experience score as a function of practice level. Both practices have averages below the national benchmark as well. Departments may need to look internally to understand where they lack communication-wise and how to increase the effectiveness of their communication to patients. On the left, we have comparison of patient experience survey score for the rating of the provider by each type of physician. Unfortunately, once again, the average physician scores are below the national benchmark of 87.2%. And on the right, we do see similar results except for internal and family medicine. We see that both of these practices are also below the national benchmark. For patients' rating of provider, I split up by service line, family medicine and internal medicine, and have highlighted in red the individual or the provider which has average survey scores below the national benchmark of 87.2%. You will also notice that I added their credentials so that we can see if they are an MD or a DO. Here you can see we have 14 out of 21 family medicine providers below the national benchmark of 87.2% for patients' rating of provider. 4 are MDs and 7 are DOs. And here we have the average patient experience survey score for patients' rating of provider for the internal medicine practice. As you can see here, we have 7 MDs and 4 DOs who have average scores below the national benchmark of 87.2%. Overall, we noticed the difference in average patient experience scores compared between physicians and compared between practice levels are minimal. Physicians, as well as internal and family medicine practice levels, are above the national benchmarks for the measures care coordination, as well as getting timely care, appointments, and information. Physicians, as well as the internal and family medicine practice levels, have average patient scores below national benchmarks for how well your providers communicate and rating of provider. In conclusion, departments need to focus on more effective communication and understanding from patients how they can be better providers so patients can have a more rewarding experience in the doctor's office. Thank you very much for your time, and I will take any questions at this point.